Let's continue the discussion we have now with microbiologist and emergency trauma physician Dr. Gil Mobley. Dr. Gil, we thank you for your time and for you Skyping in from Springfield, Missouri this morning. The study, it's good to have you, Dr. Gil. The study from Lancet, sobering to say the least. What's your take on that report?
You know, we can use the military to get people in and out. And if Dr. Frieden says we need open borders because we need to allow these people to come, otherwise it's secret because we could follow them, well, then start following them. Quarantine them immediately for 21 days when they come. 100 to 150 people come in, we flash their temperature, then they're free to go. If they have Ebola, they're a time bomb to explode with infectious serum and secretions, sir.
Dr. Gil, do you think this study will help push the administration to institute a travel ban?
Absolutely, as well as personal pressure. You know, it's on all politics is fought on a local level. We must, if we don't do the travel ban, we must quarantine these 150 people that are coming in every single day. Use the military for that instead of dropping them into the middle of a burning fire.
Well, speaking of that fire ablaze, Dr. Mobley, the World Health Organization says by early December there could be as many as 10,000 new cases a week in West Africa. So some people look at that and they say, well, that's where the problem is, so shouldn't that be where our resources are concentrated? Give us the other side of that.
Yes, sir. The truth of the matter is, and if Ron Klain has any integrity, he will say the truth. The truth is we have lost the battle in Sierra Leone. We have lost the battle in Guinea, and we have lost the battle in Liberia. The epidemiologist said on 9/25 in the Washington Post that if we don't slow this down, and it's accelerating, if we don't slow this down, it's going to rifle through the community. And everyone in these countries are going to get it. They're going to live or they're going to die. And the mortality rate is climbing upward of 70%, sir. That's the truth we need to hear.
Dr. Mobley, I'd like to know if a travel ban were put in place, how do you think it would be implemented successfully?
Ban the visas, number one. Number two, if you allow people in, you gotta track them. Come on. Nigeria was able to contain it outside of their borders. Their borders are hermetically sealed. We're allowing 150 people in a day and not following them. That's what you need to do.
You mentioned Ron Klain having this job now as the de facto Ebola czar. Should there have been someone put in charge with a medical background instead of a political operative?
You know, last Thursday, it was a good day. There was no bad news for the first 3 hours of the day. And I thought, my God, for the first time in months, the worst case scenario isn't happening. It's not playing out. But then they have now some guy with no medical expertise. I seriously wonder if the guy has to think to wonder how to spell epidemiology. And what's going to test the mettle on this guy is how long it's going to for him to come out and speak the truth about Ebola. And the truth is we have lost the battle. It's time to let the Mother Teresa's of mercy and compassion fight that battle inside, pull the military out and contain it. They need to defend us about it. Go to areas where it's not and be as vigilant as Nigeria. You don't drop firefighters in the middle of a fire. You contain it from the outside. And that's what our military needs to be doing, JD.
Dr. Mobley, only about 30 seconds to answer this question. Critics will say you're starting a panic. How do you respond to that?
All I'm doing is pointing out the gross discrepancies between what the WHO says and the CDC, what the epidemiologists say, and what Common Joe can say. You know, they say you can't catch it from a plane, but they decontaminated at $400,000 4 times. We don't know how it spread, and they need to say that. You can't use the A word, airborne, but you can catch it 3 feet away. They need to be honest with us. That's how you stop the panic.
Well, Dr. Mobley, your straightforward approach is something we welcome. We appreciate your time. In fact, we're going to invite you back on the other side of this break to talk more about what is exactly at stake in this fight against Ebola. America's Forum continues here on Newsmax TV.